Okay, we were talking yesterday about the new haphazardly improvised Republican health care bill and how it does not guarantee protection to people with pre-existing conditions. But Donald Trump says it does. But Trump just seems generally confused about what is and isn't in the bill. But enough about Trump. Let's talk about U.S. Congressman from Alabama, Mo Brooks, a member of the House Freedom Caucus. He has an interesting take on this entire pre-existing conditions issue, and it's sort of complicated. He is against the bill, but he said some things yesterday when talking about pre-existing conditions that are really confusing to many people. So let's just watch it together first and then see if we can make heads or tails out of it.
In an interview, President Trump said that people with pre-existing conditions will be protected. Insurance companies will not be allowed to deny them coverage. But my understanding is, as you just mentioned, this new legislation would allow states to opt out and allow insurance companies to refuse to sell insurance to people with pre-existing conditions as long as there's some setup for them, pools of some sort. Is the president sending a message to Congress to change that provision, or did he not understand what was in the bill?
Well, that's not my understanding of the way the bill has been reframed. My understanding is that it will allow insurance companies to require people who have higher health care costs to contribute more to the insurance pool that helps offset all these costs, thereby reducing the cost to those people who lead good lives, they're healthy, they've done the things to keep their bodies healthy. And right now, those are the people who've done things the right way that are seeing their costs skyrocketing. Now, in fairness, a lot of these people with pre-existing conditions, they have those conditions through no fault of their own.
So he makes this caveat at the end saying some of these people have conditions through no fault of their own. And yes, it's true that individual behaviors can lead to certain medical conditions. But what's completely ignored here, there's a couple things ignored here, and I don't even know where to start focusing in on this thing. Number one, whether or not you lead a good life and do the right things, it doesn't just have to do with your desires. There are completely intractable financial situations which lead to poorer health outcomes. People live in food deserts. People can't afford fresh produce, and instead they're eating frozen dinners all the time, or whatever the case may be. This idea that although there are some people who did the right thing and still got sick, if you lead a good life, you avoid ending up with a pre-existing condition. It ignores fundamental realities about what it's like to live in the United States of America.
And also as to what the role of government should be, because if we can't address something as basic as public health, then what other priorities are ahead of that?
Absolutely. When we look at how we deal with the issue of health insurance and healthcare versus how other countries at our level of development do it, it makes what Mo Brooks is saying particularly off base. Now, he's against the bill and I'm against the bill. So, okay, there's some sort of common ground there. But again, we're getting into this issue of, well, Obamacare had this provision where you can't charge people way more when they have pre-existing conditions or deny them coverage. Are Republicans going to include that provision? That's only layer one, because if you include the provision but then allow a waiver to get out of it, it's sort of a way to just pander to both sides without really making it so that people with pre-existing conditions are protected.
And as a member of the House Freedom Caucus, I think it's fair to assume that Mo Brooks is against the pre-existing condition provision. I'm sure that if he had someone in his own family who suffered from, Crohn's disease or cancer or one of these pre-existing conditions, that he would change his tune.
Probably. We've seen that happen with some Republicans, and others take a sort of pseudo-principled stance where they say, whatever my family's condition, this is sort of what I believe in. What's getting lost in this entire thing is we're forgetting the whole point of insurance and how insurance works, and the idea that in order to have a risk pool that is spread out and is not subject to big swings based on the activities of some small portion of the people in the risk pool needs to be as big as possible, and it can't exclude certain people. This is the whole point of insurance. And, I don't know ultimately where this is going to go, but serious sort of confusion as to leading a good life. And who decides if you've led a good life? We can't even agree on what the food pyramid should look like. It changes every 2 years. And objectively speaking, Mo Brooks is saying, hey, if you lead a good life with some exceptions, you're not going to end up with a pre-existing condition. So discuss this with us on our Reddit discussion forum. The American Health Care Act and the new iteration of this entire thing is generating a lot of discussion. You can find that at davidpakman.com/Reddit. Today's episode is supported by Tagadab, the hosting specialists. They offer dedicated VPS and cloud server options. They have a fantastic team of expert hosting specialists. It's also a friendly support team. It's a team that gives customers access to the full knowledge and service that they're able to provide. And 70% of their business actually comes in from repeat orders and recommendations from existing customers. They have a Trustpilot review rating of excellent at 9.7 out of 10. There's more and more people interested in moving their businesses and projects to the cloud, and Tagadab is currently offering a £10 free credit to all new customers signing up to give you a chance to try the service. And to take advantage of this, you merely go to signup.tagadab.com/TDPS. That's signup.tagadab.com/TDPS.